angiogenesis, neovascularization as it relates to wet macular degeneration. That's the conversation we're going to have right now. And basically what that means is I want to help you guys better understand what is going on with this wet macular degeneration presentation. So we're going to talk pretty much about what is neovascularization, what causes neovascularization, conventional treatment, and alternative complementary integrative treatments. So let's talk first about what is neovascularization. What happens? Long and short, the reason our blood vessels grow, which I'm going to talk about in a minute, is because there's not enough oxygen, right? The retina macula is not getting sufficient oxygen. It's not getting sufficient food supply. Therefore, the body perceives it's in danger of suffocation by not getting enough oxygen through the blood supply, and starvation by not getting the vital nutrients, as well as intoxication because the body cannot get rid of the carbon dioxide and metabolic waste products, which will create or contribute to an increased acidic degenerative environment of the eyes. So let's talk about the root mechanism here, about how wet macular degeneration, neovascularization, develops in macular degeneration, specifically going from dry macular degeneration to progressing to the wet type, okay? So we're going to unpack this step by step so you guys have a better biomedical and functional or holistic understanding of this entire situation. Very, very important that you guys understand this. Whether you have dry macular degeneration, wet macular degeneration, or if you have geographic atrophy, all right? These are all important. So as an overview, neovascularization or wet macular degeneration occurs when new fragile blood vessels are called the choroid, right? We know that the microcapillaries that feed the retina are called the choroid. Now the choroid, they grow in this process of neovascularization. New vascularization is blood vessels. So it's the term means new blood vessel growth. So what happens is these blood vessels grow from the choroid layer, and again, the choroid is what feeds the retina through its blood supply, through the Bruch's membrane, into the retinal pigment epithelium, and even sometimes into the subretinal space, right? These abnormal blood vessels are weak, right? They're fragile, they're not thick. Think of a sturdy blood vessel like a garden hose, right? It's flexible and durable. These new blood vessels are very weak and thin and very susceptible to breaking or leaking. And what happens is they could leak edema, we call that macular edema or fluid. We can have a hemorrhage, which is bleeding. We can have fibrosis, which is scarring, and which results in rapid onset central vision loss, right? Because of the bleeding that occurs, we're going to experience definitely some vision loss, and it's sudden often. If it's a little bit, I take that back. Sometimes you could get a little bit of like fluid oozing and it's not so serious, but usually with a hemorrhage, you're definitely gonna notice a significant loss of blood. So what happens here? Why does this happen? Very, very important thing you understood. It stems from what we called chronic ischemia. Ischemia means lack of blood supply, lack of oxygen, lack of nutrients to the retina. That creates oxidative stress, more free radicals, more inflammation, and a stressed out retina and macula, okay? Your body stimulates a process in your body through your brain, and your brain tells your body to create more VEGF, which is vasoendothelial growth factor, which is upregulated. What that means, that's a biomedical term, it basically means your body's going to create more blood vessels so that it can feed your optic nerve and your retina and your macula so that it can breathe and eat, right? These are feeding tubes and breathing tubes. So upon this upregulation of vasoendothelial growth factor called VEGF, we have the growth of abnormal blood vessels, right? Again, we call this neovascularization or angiogenesis. So why does this happen? We talked a little bit earlier. Hypoxia, oxygen deficiency. The aging retina becomes metabolically stressed out. It means it can't make energy, can't produce ATP, it can't repair, it can't regenerate. So the drusen that builds up under the subretinal layer and basically deposits and thickens the Bruch's membrane, blocking oxygen and nutrient diffusion, basically lack of oxygen, getting to the choroid, from the choroid rather, to the retinal pigment epithelium and the photoreceptors. They're suffocating, they're starving. All right, we talked about that. So this relative hypoxia of your retina stimulates the RPE and Mueller cells to secrete this vasoendothelial growth factor. It basically means that these specific cells, the retinal pigment epithelium and the Mueller cells, that's the structure that secretes your VEGF to grow these new blood vessels, right? Then the VEGF, that chemical, triggers angiogenesis, neovascularization, both meaning the same thing. New blood vessels begin to grow as a means to restore the oxygen supply, right? It's a lifeline to try to save your sight. So the problem here is that the new blood vessels, again, are very weak, leaky, and invade where they shouldn't, right? Think of like weeds or that just kind of get where they shouldn't be. So they need to be pruned. The second problem is inflammation and we call complement activation. I'm going to talk about that in a minute. It's a little bit biomedical term. So the complement cascade, which is basically the immunity of the eye, becomes dysregulated in macular degeneration. Genetic variants, things like that. We can have genetic things that can create damage to the retinal pigment epithelium, the Bruch's membrane, and ultimately chronic inflammation increases VEGF expression. So like with macular degeneration, the more inflammation there is, the more probability there is going to be for vasoendothelial expression, leading to new blood vessel growth. Long and short, you got inflammation, that's going to choke off the blood supply even further to the eye, less oxygen, less nutrients, so the body is going to have an accelerated need, basically, to grow these new blood vessels, just because, again, it's starving. As we mentioned earlier, oxidative stress, where the macula is exposed to these reactive oxygen species, which damage the DNA in the retinal pigment epithelium cells, which accelerates drusen, impairs waste clearance, getting the drusen and the metabolic waste out, and promotes VEGF production, right? So we're all stimulating this so the body's growing these new blood vessels because the environment is so stressful, right? It's a stress response. Very important to understand that. So ultimately, we're talking about is a breakdown here of the Bruch's membrane. Bruch's membrane, remember, is very, very, very important. It helps break down and eliminate drusen. And part of the problem with macular degeneration is a Bruch's membrane that basically just goes limp and doesn't do its job anymore. It becomes thick, it becomes calcified, and it just thickens up. And as a result of that, the drusen accumulates and builds up. So we then start to see in the Bruch's membrane things like microfractures. It starts to literally break apart and decompose. And inside that, these junctions that we have start to open up, and these are entry points to where the blood vessels can kind of come through and penetrate, and kind of coming into the areas where they shouldn't. So once this barrier, these tight junctions are breached, the VEGF basically grows these blood vessels and they'll migrate into the subretinal spaces. It's not good, all right? So again, things that can cause this are either genetic or epigenetic factors, right? We can have a genetic tendency toward this if mom or dad or grandma and grandpa or somebody in the family had macular degeneration, wet type. There could be this genetic tendency to have that, as well as epigenetic factors like smoking, hypertension, alcohol use, crappy diet, obesity, poor lipid metabolism, thyroid issues, all these other factors that can also accelerate inflammation, oxidative stress, vascular stress, and mitochondrial dysfunction, okay? So also lifestyle factors like, again, we talked about foods that have high oxidative stress, low dietary antioxidants, not enough fruits and vegetables, UV exposure, blue light, too much screen with not enough blue light protection, UV damage from the sun, all that radiation, all loads up the oxidative stress. So these are the problems, all right? From a holistic perspective, that was the biomedical perspective, from a Chinese medical perspective, we call this qi and blood stagnation. Qi being the energy, the ATP, the life force that needs to get to your retina so that they can repair, function, and do their job. We have this stagnation or obstruction where we don't have this supply of blood and vital energy getting to the eyes, so they start to degenerate. All right. Again, we talk about inflammation. We can get the drusen. In Chinese medicine, we call this phlegm damp accumulation. It's a mess. You can see how the environment starts to break down. I'm going to pause here and just interject. This is why stem cells don't work, because you can't plant stem cells into a environment that is sick and has drusen and neovascularization, acid. The body is like, grow new healthy cells. I just need to like clean this whole place up first. So the environment is not conducive to growing new healthy cells. That is why the stem cells won't take root and won't grow, because it's like trying to grow a rose garden in the middle of winter, right? Where there's snow and short days. It's the seeds are fine. The environment will not allow that. Okay, so back to our regularly scheduled program. So from a holistic perspective, neovascularization can be understood by the body's attempt to self-correct this ischemia. But because the local environment, again, is toxic and inflamed, the new blood vessels are pathological and not restorative. What I mean by that, it is not going to help, right? What we need to do is we need to restore the original blood supply to the eyes, to the retina, to the optic nerve, to the macula, so that the new blood vessels won't grow, right? Remember, the blood vessels grow because of the stress. Reduce the stress on the retina, the macula, we'll have a cessation or an arresting or stopping of this angiogenesis and new blood vessel growth, okay? So that's really important. So the next thing we need to talk about here is so conventional medicine will do these injections, right? These anti-VEGF injections that your doctor told you that are going to help save your sight. And if you don't get them, you're going to go blind, which may or may not be true, but I don't like the tone often that comes with in terms of it's a threat. It's basically a medical threat, and they can't scare people into doing this stuff. So sometimes it's true, sometimes it's not. So let's talk about the VEGF. Anti-VEGF injections. Eylea, Lucentis, Avastin, Vabysmo. Okay, all of these, you got the four. The Syfovre is not anti-VEGF. That is the geographic atrophy injection. That is relatively useless in my opinion. But we're not talking about that. For this conversation, we're talking exclusively about the anti-VEGF. Again, Eylea, Lucentis, Avastin, Vabysmo, all these injections. And what do they do? All right. First and foremost, they were originally designed to be just used as an emergency treatment when you have active bleeding. And they work pretty well. Okay. Can't deny that. Somebody's got to bleed. You do a couple of shots, maybe 1, 2, 3 shots. It reduces the blood. It is the lesser of two evils. So I always recommend that, right? If you got to bleed or you have something going on, definitely get a shot unless you have some circumstance that won't allow for that, okay? So what do these drugs do? What they do is they don't improve the health or function of the macula. They help stop bleeding by helping the body to absorb the blood, and they will slow down the progression of neovascularization, maybe. Right? And why I mean maybe is because your body builds up a resistance pretty fast to these meds, which is often why they'll bounce around from them. And a resistance is a tolerance, meaning that your nature finds a way. So basically these drugs are inhibitory. They stop the body from growing these new blood vessels, which your body is trying to go to feed and oxygenate and give nutrients to your retina and your macula. So you're shutting that system down. So now the main pipes aren't giving oxygen and blood supply and nutrients to the retina. Now you're shutting down the auxiliary attempt to try to grow these new blood vessels to the eye. So that is in and of itself going to accelerate your macular degeneration, right? Because you're not getting this new oxygen. If you're doing nothing and just allowing that process to happen and not doing anything to actively help improve the blood flow to your eyes, you're shutting that down. You're going to accelerate your macular degeneration. Why? Because your macular degeneration is a direct result of drusen deposits and lack of oxygen and food supply to your retina and macula, and a lack of cellular detoxification. Okay, we covered that. So that's the review. So again, these injections will stop bleeding and they will slow down angiogenesis. They do nothing to help your macular degeneration. They will not prevent angiogenesis. They do not do that. There is no research. You don't believe me? Go on PubMed, Google Scholar, wherever you want to do. There is no substantial evidence that shows that doing injections for people with dry macular degeneration will prevent the movement or progression from dry to wet type. There is no research. So if your doctor is telling you that he or she wants to do these injections preventatively to help you prevent going from dry to wet, that's patently untrue. Like, just if it's your choice, you want to do that, that's fine. I totally respect your opinion, but I want you to be clear on that. So now that you know what the injections are and what they do, I want to talk about what are some non-pharmaceutical ways to help prevent this neovascularization. That's kind of why you guys are here. And again, I know this is a long form video, but the reason is this is a very, very important conversation. So I want you guys to kind of sit tight with me, especially if you have dry macular degeneration, wet macular degeneration, or you have geographic atrophy, which usually comes with both wet and dry once it advances. So we're going deeper now, okay? And we're getting clear on the preventative aspects of choroidal neovascularization, CNV, in macular degeneration. Basically, what we're trying to do is target the upstream drivers that cause this cascade of VEGF. Long and short, we have to manage the factors that are causing your body to grow these new blood vessels. Long and short, restore the blood supply, reduce the inflammation, manage the oxidative stress, the ischemia, and the metabolic dysfunction long before we get to a point where we need these injections. So this is preventative medicine, guys, and it's very hard for people, especially a lot of people, to wrap their head around, because most of us, our brain works where we don't really want to deal with it till it's a major problem. Well, this is one of those things that if you deal with it when it's a small problem, it's fairly easy to manage. If you wait till you have wet macular degeneration, there's neovascularization, we can still help, but it's a mess, all right? And with absolute certainty, your savior is not the injections. Although it can be part of your holistic treatment process, they are not going to save your sight. That's what I want you to understand. So let's talk about, again, these more holistic ways to help manage or prevent and deal with neovascularization. So we talked again, neovascularization is the retina's oxygen emergency response system. It basically goes, shoot, alarms off, we got to get more oxygen. The retina's starving, suffocating. If we go blind, we die. That's basically what your brain says. Because before, we're in 2025, at the time we're recording this, thousands of years ago, tens of thousands of years ago, if we didn't have our vision, we weren't going to survive, right? You eat things that are poison, you don't see danger coming, you wander into a dangerous area. So long and short, I have a long form video on this you guys could watch, but long and short, the brain perceives lack of vision associated with death, a threat to death. So it's top priority that our brain decides that our vision is super important. So in order to prevent neovascularization in early stages, there are 5 things we need to focus on. First, reduce oxidative stress and inflammation. Critical. Second, improve choroidal and retinal microcirculation. 3, support the retinal pigment epithelium and mitochondrial function. 4, stabilize the Bruch's membrane and lipid metabolism, the breaking down of drusen. Number 5, maintain systemic vascular health. All cases of macular degeneration are rooted in systemic vascular dysregulation. It's a systemic blood vessel issue, folks. It's not an eye issue. Yes, it's showing up in your eye. It's because there are systemic vascular issues. And we know this because at least 70 to 80% of my patients with macular degeneration either have cardiovascular diseases or they have a family history of it. So important. So let's talk about these. All right, first, the first strategy is nutritional and antioxidant, right? We're going to use things like the ARIDS 2, I don't like the Preservision. I don't like the OcuGuard. They're just crappy supplements. So you can get from me our Total Vision. You can use MacuHealth. Just get your carotenoid antioxidants. The AREDS are vitamin A, C, E, lutein, zeaxanthin, zinc, selenium. They're much better AREDS supplements than the Bausch & Lomb pharmaceutical ones out there. The reason I'm saying this is not a dig on the company. We have actually tested them in clinic, and our patients who are using them don't have high carotenoid levels, which indicates that they don't break down and metabolize. I haven't researched this, but I suspect it's because there are probably binders, cheap binders in those vitamins that are not allowing when you take what's in the pill, it's not breaking down in your system, becoming bioavailable. Okay, so in addition to the AREDS, you want to take things like lutein, zeaxanthin, vitamin C, vitamin E, around 4,000 IU a day. Vitamin C needs to be liposomal, zinc and copper, right? We always want to take zinc with copper for absorption. And this reduces the risk of progression to wet type by up to 25%. Listen to what I said. By just taking a really good AREDS supplement, you can reduce your probability from progressing from a dry macular degeneration to an advanced wet macular degeneration. Beyond AREDS, there are other things we could do supplement-wise to deal with this antioxidant. We could take things like CoQ10, alpha-lipoic acid, NAD, curcumin, resveratrol, fish oil, blue-green algae, astaxanthin, mesoxanthin, berberine, chromium. All right, these are all, I'm just kind of rattling off a bunch of antioxidants that are friendly and supportive of our ocular system. These, again, if you start taking these, all these are in our Total Vision formula. They will help slow down and at least by 25% reduce the probability of advancing to wet type macular degeneration. Second thing we need to talk about here is microcirculation. Blood flow is critical. The oxygen, you guys heard me say this before, the retina in the visual system is the highest oxygen consuming tissue in the whole body. It uses a lot of oxygen to make a lot of ATP energy for this process of getting visual information from the retina to the optic nerve to the brain to the prefrontal cortex. Very important, a lot of energy use in this process. So there are factors that we can do and tools we can use to help increase microcirculation to the retina, to the macula. All right, and it's basically oxygenation and nutrition. Get it to breathe, get them to eat. All right, so ophthalmic acupuncture is something we use in our clinic. There is tons of research now that shows through ocular Doppler that acupuncture, specific acupuncture techniques and protocols will increase blood flow to the retina and macula. So we saw this again with our studies we did with Johns Hopkins and Nova Southeastern, that we used ocular Doppler to show it does increase blood supply to the retina for sure. So we're increasing ocular blood flow via nitric oxide mediated vasodilation. So eat your beets, very important for vasodilation, for nitric oxide. We're also going to modulate the autonomic balance of sympathetic vasoconstriction, vasodilation, which is important. We're reducing, the acupuncture is going to help also reduce the inflammatory cytokines, which are very, very important with a lot of cases of macular degeneration. We're also supporting the retinal and choroidal microcirculation, right? We got to get that blood flow. Blood flow is the foundational premise to everything we're trying to do for you guys. Get the blood flow go, the cells can breathe, they can eat, things should, and detox, they should be okay. The second, for those people who can't get acupuncture, they can't get to my clinic or whatever, we have home treatments that we also do in clinic, which is alternating current microcurrent stimulation. So we use a very low level AC current. Before this, up until about 5 years ago, we're using DC current, which does not penetrate deep enough and simply does not get the results that alternating current does. So we have our home units called alternating current stimulation, which in my opinion is arguably the single best thing you can do in terms of supplement lifestyle modifications to help save your sight. Now you can amplify those results by using red light therapy or red light glasses, which are 3 or 6 minute treatments that you can do to help improve that process. So basically those will help the mitochondrial retinal mitochondrial insufficiencies. And what happens when the mitochondria get weak, they don't produce energy, which is very important. And more importantly, they start to destroy your healthy retinal cells and macular cells. That's right. Maybe you weren't aware of that. I'll say that again. Your mitochondria that become dysfunctional will hyperactivate a process called apoptosis, programmed cell death, where they're going to destroy your healthy cells. So getting your mitochondria cleaned up and energized is critical to your vision preservation. So this energy, the microcurrent also is going to enhance oxygen utilization and microvascular circulation. So we're also reducing the retinal edema and inflammatory mediators. And also we know that the alternating current stimulation penetrates deep enough to stimulate the Bruch's membrane so that the junctions get tight again. So there's no leaking and no perfusion, and they're going to tone the Bruch's membrane so that it can break down the drusen and get rid of it. All right. So again, I want to talk a little bit more about the red light therapy I mentioned. The benefits of the red light glasses, again, our red lights that we use, again, it's a 3-minute treatment, 6 minutes for patients before 10:30 a.m. And what these do, they stimulate the cytochrome C oxidase. All right, basically that's a fancy chemical that tones the mitochondria. It increases ATP, reduces oxidative stress, improves the retinal pigment epithelium and photoreceptor survival rate. Okay, some randomized trials showed improved visual function. We've seen a tremendous improvement with red light therapy. Again, do not use the panels. They're way too strong. Only use the specific red light therapy glasses that were designed for your eye health. Okay. Number 3, we need to be systemic about this in lifestyle. Right? You have a body attached to your little ping pong sized eyeballs that are in our head. So we need to do things like, if you smoke, quit, reduce oxidative stress. Look, doctors have been saying this since like the 50s and 60s. Smoking creates free radicals. That includes vaping, that includes cigars, anything, right? So anything that is going to create free radicals. Alcohol stimulates, too much blue light, too much screens, pollution, toxins, medications. The stronger the medications, the more free radicals it creates. So look at your diet, all right? In our online group coaching course that we offer, the AccuVision Recovery System, we go very, very deep into lifestyles, sleep, hydration, all of it, to make sure that you're on point so your body's healthy to allow your vision to recover. The diet, I like alkaline diet and Mediterranean type diet. If you're just kind of mining for that, intermittent fasting works very well for some. You have to exercise and move your body. Good for the cardiovascular system. And as I said, we know macular degeneration is rooted in cardiovascular disease. Make sure you understand that. Conventional ophthalmologists are clueless to this. And they just are not taught that. They're not dumb. They're not, I'm not saying anything derogatory. This is not in their curriculum. They're not taught this, so it's not something that they're aware of. I become aware of this just because my patients have shown up with this in clinic. So vascular metabolic health is very, very important. Keep the blood pressure low, the blood sugar low, keep the homocysteine low. If you have things like MTHFR, that really having problems with methylfolate, so we need to folic acid, we need to really regulate that. So we know homocysteine, C-reactive protein, are inflammatory markers, blood markers that indicate higher stress, inflammatory stress on the circulatory system. Okay, so the 4th major thing that you guys need to do to help reduce the possibility and probability of creating new blood vessels is stress reduction, right? This is not talked about enough. So chronic sympathetic dominance, stress, right? Sympathetic, parasympathetic. When you're in high beta or you're stressed out, what happens is this constricts the retinal arteries and blood vessels, which increases the ischemic load. You're redlining the pressure, right? And it's going to blow. So reducing stress relaxes the blood vessels. That's why magnesium is really important. Relaxation, exercise, meditation, Tai Chi, Qigong, yoga, right? Unplugged. Stop watching the news. Stop engaging in lifestyle activities that are creating more stress for your life. All right? So those are really important. So I want to mention a few other experimental, what I mean by experimental is they're not research proven yet, but they do have anecdotal use, and I've seen benefit in my clinic. So I'm going to kind of mention a couple of things. Ginkgo biloba, very, very important for microcirculation. That will absolutely help prevent neovascularization. Also things like Mark Grossman is a colleague of mine, good doctor. He has what's called a blood vessel control formula. That's on our Eye Health Institute website. So that is one of the best things. This is what I give to all my patients with dry macular degeneration to prevent wet type macular degeneration. I used to only give it to my patients with wet macular degeneration. Everybody with dry macular degeneration gets it now. On top of that, we're giving people we're giving them proteolytic enzymes, okay? Nattokinase specifically has some research mounting that shows that it can help prevent. It's a natural anti-VEGF. All right, you need to take nattokinase on an empty stomach, though. Very important. Bilberry, all right, can help strengthen the capillaries. Saffron has neuroprotective, improves visual function with macular degeneration. The new kid on the block is methylene blue, which helps with mitochondrial support and neuroprotection. All right, so these are a couple of supplements that I think might be beneficial. So again, summarize what we're trying to do is we're reducing oxidative stress, reduce inflammation, improve microcirculation, improve mitochondrial cellular energy, and get the mitochondria back off so they're not destroying our healthy cells, reduce vascular risk, and reduce stress vasoconstriction. These are very, very important things. Again, so in summary, neovascularization is preventable, right? Just keep that in mind. It's very important because your eye doctors do not talk to you about that. They're like, we'll just watch it. Once it becomes wet, then we're going to start the injections, unless they've already started them with you. So if you control the biochemical environment that provokes the vasoendothelial growth factor, which stimulates the new blood vessel growth, you're in good shape, all right? Anti-VEGF injections treat the symptoms, but not the cause, which lies in oxidative stress and metabolic dysregulation. The best natural prevention for comprehensive metabolic, circulatory, and antioxidant support protocol is what we offer. That is what our system is about. We have at-home programs for those of you guys who can't travel. We have in-office treatment programs. We have our online group coaching that is going to teach you how to save your sight. Everything that I've learned over the last 30 years that has to do with holistic eye health has come from that knowledge base that I put into an online course for our patients. So if you're interested in learning more or you're ready for some help, reach out for a conversation. I'll talk to you, my team, and I will talk to you more to find out what's going on, to find out if or how we can help you, and if so, what the best path forward for you to help recover your vision. Whether you are early stage macular degeneration, dry, mid stage, later stage, you advance to wet, or if you have geographic atrophy, it is all manageable. And simply relying on these injections and thinking they're going to save your sight is not enough. You have to do more. You don't have to. You do whatever you want. But if you're looking for help and this sounds something that may be a fit for you, reach out to us. We'll have a conversation and get you going. Dr. Andy Rosenfarb here with AccuVision. Your vision is our mission. This conversation was about wet macular degeneration, VEGF, and how to help save your sight. See you soon.